first step to getting an FUE hair transplant is your consultation. This gives you the chance to first meet with the surgeon, discuss your hair loss, and go through your medical history. They will then analyze your hair and assess your suitability for a hair transplant. First, our nurse will apply a numbing cream above the patient's eyebrow, where anesthesia will be injected later. Then we will collect a blood sample from the patient, which will be used later for plasma extraction. The back of the patient's head is shaved and prepared for the surgery. The area where hair will be harvested is thoroughly disinfected. Anesthetics are injected into the back of the head to ensure the patient feels no pain during the procedure. Additionally, a saline solution is injected to expand the area and improve the visibility of hair follicles.
Before we continue, please visit FUEHairTransplant.com for more information.
The hair graft extraction begins. During this step, the surgeon uses a specialized tool to extract donor grafts from the patient's donor area. In the FUE procedure, grafts are always extracted one by one. This type of extraction does not leave an elongated scar on the donor area. Once a graft is extracted from the donor area, our nurses take active measures to preserve it for implantation. It is cleaned, sorted according to the number of hairs it contains, and submerged in an active plasma solution, which maximizes survivability. Once a sufficient amount of grafts is extracted, the surgeon begins implanting them using the implanter pen DHI method. Our nurses load individual grafts into the implanter pens, one at a time, and pass them to the surgeon. This method of implantation allows us to implant grafts between existing hair and produces a very high density of implantation. After the main stages of a hair transplant are completed, it is important to follow the correct aftercare procedures. This includes washing the donor and implantation areas, protecting the transplanted grafts, excessive rubbing, impacts, and direct sunlight. The surgeon will also schedule a follow-up a day after the hair transplant to check on the recovery progress.